I started in family medicine here, where I'm at right now, 30 years ago, and I've not left since. So I'm one of those rare birds that started in the same place and ended in the same place for 30 years as traditional family medicine. When I first started, I delivered babies, I did surgery, I did house calls. I saw families that grew to 3 to 5 generations over those 30 years. I'm married to a pediatrician, and we have 5 physicians in our family in my generation, and I absolutely love medicine. I could not see doing anything else, and the love of medicine was such that it didn't seem like going to work every day. It was just what you did, and it was fun. It didn't seem like work, but the day finally came that it was work, and that's when things had changed. And it was for all the same reasons that you see in your research today, that 65% of all physicians are burned out. So I left the practice for the same reasons everybody else is burned out. Those reasons have already been well described. It's a clerical work. I went from dictating my charts to doing 3 to 4 hours a day of data entry and clerical work and medical records and filling out forms. And the time spent with patients went from half-hour visits to 10 to 15-minute visits, and you just can't do a good job with people in the kind of time that we're doing. I wanted to continue to practice medicine, but I really couldn't do it the way that traditional medicine has evolved to today. So I looked and explored for other ways to continue to practice the way I wanted to practice, spend time with my patients, teach them about things, and not spend so much time with regulatory paperwork and insurance. There is a really rising trend in this country called direct primary care. And direct primary care is where physicians in primary care are able to have the relationship with the patient directly by cutting out the insurance companies. What happens with that is the patient pays the physician either a yearly or a monthly retainer fee, and you purely just take the patient's fees, and you don't bill insurance. You opt out of all insurance. The biggest change in the practice since coming to this model is, I would call it back to the future. I'm practicing medicine the way I did 30 years ago. I'm spending more time with people. I'm teaching them about their diseases. I'm able to talk to specialists when I need to coordinate care. I'm able to take phone calls myself. I can call the patients myself about their labs and their results and their questions and answer them on the phone. In the old model of care with insurance, physicians usually don't get paid unless the patient is in front of them. In this model, that doesn't matter anymore. Our goal is really just to take really good care of the patient no matter what it takes. How we communicate with patients differently in this practice that we really couldn't do before was also related to the HIPAA issues. You couldn't email, you couldn't text, and patients really want that. They want that accessibility. So they would call the office, talk to a receptionist, send a message to the doctor, who would then get it hours later and then reply, and the receptionist would call the patient back. We don't do that. They can text me, they can email me, they can call me, and I reply to them directly. I had a patient who was 26 years old, and she had been diagnosed with schizophrenia for the past 8 years. When I first got her charts, which were on paper, they were 1,800 pages long. It took me 8 hours. They were spread out over my kitchen table to go through everything. She had been to tertiary care centers, many doctors. It turned out that she had adrenal insufficiency syndrome, and that when we began treating that, her schizophrenia, which was a misdiagnosis, went away. She went from taking 28 drugs, of many of them psychiatric meds, to now being back in school and working, and is normal now. And that would never have happened in any other traditional family practice or in any other payment system, because you are not paid to spend 8 hours at your kitchen table looking at all this unless you have a model like this, where they pay up front for you to get to know them, and then everything else is covered. I love pediatrics, and we had a mother of 3, all under the age of 5, and her husband had been out of town, and the boy, being a boy, climbed, fell, gashed his leg, and she called me frantic.
When this incident happened with my son, I quickly communicated with Dr. Say, I called him and texted him, and he was able to call me back within seconds. And in order to see the cut, he FaceTimed me. He immediately said, "I'm coming over." Just that gave me a little bit of calm and reassurance, and was able to get my act together. Just waiting on him, because I also didn't want to leave my son with his leg bleeding so much and maybe passing out, I don't know. So not only did we get prompt care, but I mean, it was the true VIP service. I mean, he drove to my house, he picked us up, he drove us to his office, he stitched up my son and drove us home. So it really can't get any better than that.
The average concierge practice and direct primary care practice can be anywhere from 800 patients to about 1,200 patients. And that's either a pure practice or a hybrid. However, my practice personally is capped at 400 people, and contractually it's in our contract that says I will not take any more than 400 patients, purely because I do teaching at both Notre Dame and the IU School of Medicine, and that helps me with keeping the limits down. Okay, so I'm a little bit different in that way. But the national number is about 8 to 1,200 people on your panel size. In comparison, the average family doctor in this country takes about 2,500 plus in their panel size, and I came from a panel of 4,700 patients when I retired from that practice. The phrase that I use and I hear from patients, I would apply to myself, but I hear this from my patients: you don't know how bad it was until you know how good it can be. So when I started this practice, I had to walk the walk. That meant I had to exercise, I had to eat healthier, I had to get sleep. I had to come to peace with myself in terms of my family and my priorities and my faith. And now that I'm here, I think what it's done is it's changed me. All the things that I told my patients to do, I'm doing. And it takes work. But I think I've lost 16 pounds, changed all my numbers, got fit, sleep so much better, and I can tell you my marriage of 35 years has never been stronger. And I know my kids now. The guidance I would give physicians to be successful with starting out in this practice is you really have to have built a reputation in town. For this to succeed, you have to work at it. You really have to have had a reputation of quality and service, and patients should know about you. Secondly, for someone who already is in practice, has been in practice for a long time, they can bring their patients with them, provided that, for me, it was an issue with non-compete. But most of the time your reputation is set, you bring people with you. Thirdly, you really need to get involved in the community. You need to get your name out there, people know who you are, what you do, and where you're at. And then lastly, the most important thing that engenders success is the person next to you. You can do all the right things in terms of the model, getting the patients in, making the right diagnoses, but that person who sits next to you, who runs your practice, if that doesn't go right, then those practices fail. Direct primary care can appeal to the working class, and it can be scaled to just about any demographic. The reason for that is when deductibles became so high for someone making $30,000, $40,000 a year, but their deductible is $2,500. If they sign up with a program like this, they're having to pay that money out anyways without insurance helping them. And when you have a much closer and direct relationship with your physician who knows you and is immediately accessible to you, you save emergency room visits, urgent cares, and you do a lot more prevention to keep the costs down. And so this is not a glorified urgent care that's making the best doctors only accessible to the rich. This is more about changing the system to bring back the relationship between the doctor and the patient.